Hi everyone. Hi everyone. Good afternoon. Am I audible and visible, guys? Give me a thumbs up if I'm audible and visible. Second. All right. Okay. So, quick revision of demography today. Last time, we had to have demography, but I don't know how I put biostats that day. Alright, so demography is left, so we will be doing demography today. Okay, and contraceptives, obviously, we can't do too much of a detail right now of contraceptives. So we will be looking at the important questions that have come before from the topic of contraceptives, which will help you revise. Okay, guys. Alright, so that's the plan for today. Demo as well as health Neha, sorry, contraceptives. Okay, demography and contraceptives. Chalo. So without much ado, let us start with the questions for today. Alright, good afternoon. Yesterday we did not have a class, so keep following the roster for tomorrow as well. Okay, alright. Now you all know what is demography. Just a definition. It is the size, composition, it is the study of. Okay, what is it? It is the study of size, composition and distribution of population. Okay, it is the study of population. But if I ask you what is the study of diseases called, what will be your answer? If I ask you what is the study of diseases, everybody, क्या लिखोगे आंसर में? बिफोर वी गो टू दी MCQ, जस्ट अ सिंपल थिंग आई वांट टू नो फ्रॉम यू. If I ask you what is the study of diseases called, what will you call? Good afternoon, good afternoon. What is the study of diseases? Diseases के study को क्या बोलते हैं? If anybody would like to answer, yes, study of diseases, everyone, is known as epidemiology. Very good. Okay, epidemiology, and which we have already covered. And when we have to study population, guys, the size, growth, composition, all those things, when we are studying about the population, it becomes demography. All right, okay. Now let's go to straight away to our MCQ and try to do everything. So this is a PYQ. This is an FMG PYQ. What do you understand by demography process? Okay, it does not include. What does demography process does not include? Did you understand the question? देखो, demography is the study of population, right? We all know India की population is continuously increasing, right? Even though it's increasing at a slower rate, but it's definitely increasing. So when I say what are the factors that govern demography demography, like wow, what are the things related to it? Very good. Most of you are writing B. Some of you have gone for C. No, it is definitely B. देखो, when can you say population is increasing or decreasing? Okay, one reason is marriage. When people marry, they start having children, so fertility, right? Fertility. Then the couples decide to migrate from one country to another, migration. Okay, then also social mobility, guys. What is social mobility? It is nothing but movement. Okay, social mobility is nothing but mobility से movement. Movement at which level? Movement at socio-economic level. Okay, social mobility is what? Movement at socio-economic level. Okay, and then also mortality. When people are going to die, okay, when there is death in the country, population is affected, right? Okay, so this answer becomes what? Morbidity. Okay, so what is morbidity, guys? Morbidity हमने पढ़ा था health indicators में, the first class. Alright, what is morbidity, guys? जो हमने first class में morbidity पढ़ा था. Please remember, morbidity is not death. Migration means from one country to another country. Like you might leave India and go settle in US. USA people might come and settle in India, right? So that is it. Morbidity, very good. Morbidity is spell illness. Very good, Kush. Spells of illness. Like it is incidence and prevalence of a disease. Okay, incidence and prevalence. Alright, but death rates, mortality will definitely govern the demography. Okay, the size of the population. Will you remember this, everybody? Thumbs up. Then only I'll go to the next question. Okay, everyone understood? आप अपने से सोचो, you can think for yourself that what is governing, what is responsible for the size of a population. So these are the factors which are responsible: marriage, fertility, migration, social mobility, as well as your mortality. Now obviously our next question will be what? What do you think? Demography gap, which is demography model, right? So before we revise the demography model, what is the answer to this? Demography gap is maximum in which stage? Early part of stage 3, late part of stage 2, stage 1, stage 5. पहले आप आंसर दो, then we will discuss the model. Okay, maximum पूछा है मैंने, maximum. Very good. So most of you are writing late part of stage 2 just because you've memorized. No, you need to understand this model. So another 2 minutes we will spend to revise the demography transition model, guys. Okay, now what is demography gap? If you can tell me. I hope I'm not going too fast. Okay, all right, so we have 1 o'clock ka time, so we have to wrap up also. So in case you find my speed is fast, okay, you can let me know and we can look at your doubts towards the end. All right, what is demographic gap? I hope you remember crude birth rate minus crude CBR minus CDR, right? CBR minus CDR, ठीक है? All right, अब यहीं पे question will come, what is CBR, what is crude birth rate, because they ask you this. What is crude birth rate, everybody? Crude birth rate क्या है? Total number of births or live births? Total number of live births, okay, per 1000 mid-year population. All right, that is what is crude birth rate. Okay, and when we have to talk about crude death rate, CDR, what is crude death rate, everybody? What is crude death rate, guys? तो crude death rate होता है तुम्हारा total number of deaths, right? Total number of deaths per 1000 mid-year population. And in FMG they asked a question that when is mid-year population taken? So can you tell me, when do we consider mid-year population, everybody? That is also one MCQ. Mid-year population is counted on the 1st of July. Please don't say 1st of March or 31st of March. No, it is counted on the 1st of July. All right, also one more information, what is the current crude birth rate of our country? So it is 19.5 per 1000 mid-year population. Okay, and what is the current crude death rate of India? 6 per 1000 mid-year population. Just look at this information. Okay, you will understand the relevance of it later. अब एक क्वेश्चन आता है, not 6.2, it's now 6. Okay, Himanshu, there's one question, who told me this, that the birth rate and the birth rate as well as the death rate of our country is 19.5 or 6. Okay, who told this, everybody? Who told us this? Who told me this? Can you just give me a moment? I just have एक second, रुको, हाँ, just a moment. Okay, all right. So who told us that? How did I get the information that CBR and CDR is this much? Not NFHS, not NFHS. Who gave this information which comes as FMG PYQ? SRS, Sample Registration Survey. Very good, Pragya has written it correct. Very good. Not WHO. WHO is an international organization, right? It's not bothered about giving minor details of India. वो health and वो sector पे काम करता है, ठीक है? SRS, Sample Registration Survey. There was once an MCQ in FMG exams, guys, that SRS, what all information it provides. This is also a PYQ. If you remember, it is telling about CBR, CDR, annual growth rate of a country, infant mortality rate. Oh, okay. All right, that's a good joke. ठीक है. All right, dopamine, so sorry. ठीक है. Maternal mortality ratio. ठीक है. Neonatal mortality rate. All this information is given by SRS. All right, guys. Okay. So देखो, एक MCQ में I've told you so many things. The definition of CBR, the definition of CDR. When do you consider mid-year population? What are the current values of CBR, CDR? Who is giving this information? SRS. And and what are the data it gives. Yes, SRS is conducted every 6 months. Very good, Bhaskar. It is also a dual recorder system which can come in your exam. ठीक है, क्या है ये? Dual recorder है. That means it's not like it has a part-time enumerator and a full-time enumerator. ठीक है, so this is about SRS also. Now let us go and understand the model. Okay, now look at this diagram. So what happens? What is the name of this image? The name of image was also asked in FMG exams. Is it population cycle? Is it growth cycle? Is it demography cycle? Actually, what is the name of this? Dual recorder का मतलब, Sakshi, there's a part-time enumerator who will collect data, and then there's also a full-time enumerator, and both the datas will be matched. Okay, this is transition model. Okay, very good. This is demography transition model. Okay, this is demography transition model, guys. And how is the don't say demography cycle. Okay, it is actually the correct and the most appropriate name to this is demography transition model. ठीक है, what is the name to this? Demography transition model. Okay, all right. Okay, now कैसे हम लोग डेमोग्राफी साइकिल रिवाइज करेंगे? देर इज अ CBR and there is a CDR. So in the first stage when a country is formed, okay, it will gradually evolve, right? So in the first stage when a country is formed, CBR is also high and CDR is also high. ठीक है, तो जब दोनों हाई होता है, what is going to happen? Population is stable. But since both are high, everybody, CBR is also high. ठीक है, CDR is also high. So both are high, so population is stable. What is the name to this, everybody? High stationary. Okay, high stationary. Then what happens? The country starts to develop, hospitals banenge, they will start tackling the death rate first rather than family planning. So they will start looking at the death, start to decline the mortality. So CDR starts to decline. Abhi nobody is bothered about the CBR. Whatever is the CBR, we don't care abhi, because we first have to decline the death rate. So CBR is still high. Okay, so what is going to happen? Population is expanding, high. Okay, or you can also say population is early expanding. Don't write high, early expanding. Early expanding matlab population is growing at a faster rate. Ekdam, it's like running, tuck tuck tuck, the population will keep on growing. Okay, then what happens? The hospital services still get better, so CDR continues to decline. Okay, it continues to decline. ठीक है, now the people are worried about, the government is worried about family planning. So for the first time ever, okay, the CBR क्या होता है? Starts to decline. Okay, CBR क्या होता है? Starts to decline. So now the population is still expanding but at a slower rate. So इसको क्या बोलते हैं? Late expanding. Population is expanding but at a slower rate. Okay, ultimately the CDR hospital services are very good, CDR be low, CBR be low. So what is happening over here again? When both CBR CDR is low, population is stable, and इसको क्या बोलते हैं guys? This is nothing but low stationary. Okay, this is nothing but low stationary. Okay, and last में finally there's a rate at which deaths will decline. Okay, there's a rate at which deaths are going to decline. एक rate है जिस पे deaths decline करेगा. All right, it can become stable or decline very slowly, but family planning can go on, you know, we can give family planning to any extent. So ultimately, finally, what is going to turn out? That CBR will become ultimately less than CDR, and this is known as declining phase. Is it clear? CBR तुम्हारा CDR से कम हो जाएगा, and this one is known as what? CBR becomes less than CDR, and this stage is known as declining phase. Got it, everyone? Did you understand this? Birth rate, death rate से कम, so this is known as declining phase. Okay, now can you tell me, look at the diagram over here, demographic gap क्या होता है? CBR minus CDR. So where is the demographic gap minimum? See, the gap between purple color is birth rate and the blue color is death rate. So कहाँ पे, ठीक है, गैप एकदम कम है in stage 1 and stage 4, right? All right, where is the gap maximum, everybody? Where is the gap maximum? If you see, where is the gap maximum, like which came in your MCQ? Late stage 2. Okay, and where does it starts to contract? Starts contracting, guys. कहाँ पे contract करने लगता है? So that starts contracting early stage 3. And ultimately, where is it negative? That means CBR has become 10 and CDR is still 20. So 10 minus 10, 20 minus 10. So where is it negative? It is negative in stage 5, everyone. Got it? Everybody, did you understand this point? Okay, this is very, very important. The model, all the stages. Please remember, FMG exams may in one single paper, 2 questions from demography turn up. Okay, if you look at your PYQs, okay, on prep ladder, I have taken last 5 years PYQ. Okay, please go through that lecture. Okay. All right, on prep ladder I have taken last 3 years ka 5 years ka PYQ, most important. You can go through that on the channel, you will find it. All right, stage 5 में CBR has become less than CDR. CDR ऐसे stable हो गया है, okay, and birth rate, family planning is improved to such good extent that birth rate keeps on declining. Okay, everyone, can we go to the next question, guys? Okay, I hope you all have understood. Chalo, now based on what you've learned, yes, late expanding stage 3. Now, can you tell me, okay, before this question, can you tell me which stage will a country never want to be in? Can anybody tell me which stage would a country never desire? Which stage a country never wants to be in? Country never wants to be in. Who's going to tell me this? कौन से stage में country कभी भी नहीं आना चाहेगा? Can you give me this answer? Very good. Here everybody, I think, is writing this. In a European country, there are low births and high deaths reported, right? So that means CBR has become less than death rate. Okay, low births, and so this is declining phase. Okay, now can you answer this? Which stage a country would never want to be in? Stage 1, 2, 3, 4 or 5? कौन से stage में country आना ही नहीं चाहेगा? What is it? Very good. Santhini, I think, has got it correct, guys. Not low stationary, stage 2. Stage 2. Why? Because it is early expanding. What do you mean by early expanding? It means that the population is growing at a faster rate, right? There is what? Population explosion. And what is this stage called as? This stage is also called as demography trap. Okay, the country is stuck. Okay, demography what? Demography trap. इसको क्या बोलते हैं? Demography trap. Okay, the country has been stuck in this phase. ठीक है, so it is also known as demography trap. Got it, everyone? Did you understand this question? Okay, it is very, very important. Please don't mess up this. Demography trap क्या होता है? Which is the stage desired by country? All right, what is the stage desired by a country? So that stage, everyone, which is desired by a country is stage 4. Don't say declining. Okay, it is low stationary. Every country wants to come to this stage. Okay, low stationary, not late expanding, low stationary. All right, okay, chalo, next question. Why is late expanding stage of population in India due to? Now here, tell me the answer. A, B, C, D. Late expanding stage India का क्यों है? Anyone? Why is there late expanding stage? Okay, why is there late expanding stage of India? Anyone? Okay, are you writing? पढ़ो इसको. Late expanding stage. I just gave you the values, guys. This is also PYQ. I just gave you the values. Remember the values, and based on that, very good. You all know CBR currently is 19.5. CDR is 6. So you can see that death rate has declined at a faster rate than birth rate, right? Both are declining, but you can say death rate is declining at a faster rate or birth rate is declining at a slower rate. Very good. So यहाँ पे आंसर हो गया death rate declines faster than birth rate. Good, everybody knows this. Okay, now next point, some fertility indicators, a very favorite topic of FMG exams. fav topic, okay, favorite topic है. बताओ, it has been repeated so many times that I cannot tell you. You need to revise this, okay? So what is true about total fertility rate? Sensitive indicator of family planning achievement, complete family size, number of live births per 1,000 married women in reproductive age group, average number of girls born to a woman. I will just give you a trick to remember these definitions, okay? All right, very good. True about total fertility. So some are writing C, some are writing B. देखो guys, total लिखा ही था. Total का what could be the other word for total? The other word for total could also be complete, right? The other word for total could also be complete, है ना? The other word for total could also be complete. So complete family size. But what are these things? Okay, so let's once quickly revise these definitions, then I'll come to the questions. See, when you talk about, just read with me this, okay? You'll always revise in this particular order only, ठीक है? जब भी हम लोग fertility indicators पढ़ेंगे, then we'll go to the MCQs. You will revise in this order only. The first one is CBR. CBR is crude. Total number of live births per 1,000 mid-year population. Okay, it is total live births per 1,000 mid-year population. Now, what is the problem in this? What is, just read with me this, okay? What is the problem in this? Mid-year population mein there are men also, children also, elderly also. Now, can everybody give birth to babies? No. Not everyone is exposed to the risk of childbearing, right? Can everybody give birth to babies? No. So, next we took what? General fertility rate, where total number of live births per 1,000, what did we do? We made it women in reproductive age group, because women can give birth to babies, right? तो हमने क्या कर दिया? To make it a little more specific, what did we do? Instead of mid-year population, we made it women in reproductive age group, 15 to 49. Now again, women in reproductive, can a 16-year-old girl, like, is she at more risk of having children? No, because she is not married. So we made it a little more specific by writing what? Total number of live births per 1,000 married women हमने कर दिया. So it becomes general marital fertility rate. Is it clear, everybody? Did you understand these three things? Crude birth rate, total general fertility rate, and general marital fertility rate, okay? All right, ठीक है? In the denominator, women in reproductive age group, married women. But what is total fertility rate? Total fertility rate होता है total number of children a woman will have throughout her reproductive lifespan. From 15 to 49 years, how many children did she have? Okay, all right. That is why this is an indicator of complete family size. कितने बच्चे हैं? Like suppose this is a couple, okay? This is a husband and wife. They have one daughter and they have one son, okay? ठीक है? They have one daughter and one son. Can you tell me the family size of this? Can you tell me the family size of this family? बताएगा कौन? Family size कितना है इस family का? 1, 2, 3, 4. A family has, this is a couple, these two red color में, they are a couple, okay? Father, mother. They have a girl and a boy. So 1, 2, 3, 4. See, you will not say 4. Family size का मतलब होता है total number of children only, okay? Total complete family size means children that they will have from 15 to 49 years. So total family size यहाँ पे बन गया तुम्हारा 2. Okay, so total fertility rate is how many children a reproductive age couple is going to have, okay, right from 15 to 49 years. All right, now what is gross reproduction rate? Just look over here, G for gross. Gross matlab, gross say you remember what? Girls, okay, girls. So if there are 4 children, by law of probability 2 are girls. Okay, so gross reproduction rate मतलब होता है total or average number of girls. Okay, right from 15 to 49 years, how many girls a couple will have. All right, that is what is gross. And net reproduction rate means what? How many will remain alive. Okay, how many will remain alive. ठीक है, नेट रिप्रोडक्शन रेट का मतलब क्या होता है? हाउ मेनी विल रिमेन अलाइव कंसीडरिंग द करेंट मोर्टैलिटी. कितने लोग अलाइव रहेंगे कंसीडरिंग व्हाट? कंसीडरिंग द करेंट मोर्टैलिटी. ओके, सो इन वेरी सिंपल वर्ड्स, टोटल चिल्ड्रन देखो क्या है? TFR. टोटल चिल्ड्रन में हाउ मेनी टोटल गर्ल्स? GRR. And last में how many girls remain alive. Okay, how many girls remain alive, guys? So how many girls remain alive? That is NRR. Got it? Everybody, yes, this can definitely come in your NORCET exams also. Okay, so how many girls remain alive is your NRR. Got it? Everyone, did you understand this concept? Now considering Himanshu, ध्यान से सुनो. देखो, the first indicator is, when you talk about the first indicator, it is crude. Just listen to me, everyone. Focus, okay? Just listen to me. First thing is crude birth rate. Okay, total number of live births per 1,000 mid-year population. But everybody in the mid-year population cannot give birth to a baby. So we have given जनरल फर्टिलिटी रेट. डिनोमिनेटर में क्या कर दिया? वुमेन इन रिप्रोडक्टिव एज ग्रुप, बिकॉज दे कैन गिव बर्थ. नाउ एवरी वुमन इन रिप्रोडक्टिव एज ग्रुप इज एक्सपोज टू चाइल्ड बेयरिंग? नो, मोस्टली द मैरिड वुमेन. सो वी डिड व्हाट? मैरिटल फर्टिलिटी रेट. ओके, प्लस, ठीक है, फिर होता है तुम्हारा टोटल फर्टिलिटी रेट. टोटल फर्टिलिटी मतलब क्या होता है? अ वुमन राइट फ्रॉम 15 to 49 years, हाउ मेनी चिल्ड्रन कैन शी हैव? चिल्ड्रन. Okay, and out of that how many girls she had? G for gross. Okay, and out of that how many girls remain alive? So that is what? Net reproduction rate. Okay, all right everybody, thank you Sahil. Chalo, okay, now come back to MCQs. So the first one was total fertility rate. Okay, all these are FMG PYQ. Okay, so the first one, look over here. 2 about total fertility rate. Now please remember, sensitive indicator of family planning achievement is NRR. Okay, that is one of the sensitive indicators. Number of live births per 1,000 married women in reproductive age group क्या हो जाएगा? General marital fertility rate. Average number of girls, गर्ल्स से G for G, गर्ल्स से gross reproduction rate. Okay, everybody, ठीक है? All right, so that is very very important. Good. Per 1,000 women है, sorry, married women है ना, married woman. So general marital fertility rate. Okay, all right, let's look at some other MCQ. Now look at this. This is also a PYQ. Number of live births per 1,000 women in reproductive age group in a year refers to. So what is your answer over here? Guys? What is your answer over here? Can anyone tell me the answer? The number of live births per 1,000 women in reproductive age group. Very good Bhaskar, very good Sakshi, very good. Most of you are writing very good. I just told you numbers is order में, just study in this order. Okay, CBR, then general fertility rate, general marital fertility rate, total fertility rate, gross reproduction rate, net reproduction rate. Okay, all right, one more PYQ देखो इस टॉपिक से. Mortality, this came in December 2020. Very simple. Mortality is taken into consideration. Where do you take mortality into consideration, guys? Mortality is taken into consideration, and I am sure now everybody knows net. Okay, remember net reproduction rate में mortality रहते हैं. Total fertility rate is an indicator of complete what? Family size. Okay, gross reproduction rate होता है तुम्हारा number of girls. Clear? Fertility indicators everybody? Okay, Chalo, all this we have done. Yeah. Now tell me this, to achieve a net reproduction rate of 1, the couple protection rate should be a minimum of. This is both NEET and FMG question. Okay. What is net reproduction rate of 1 means? Remember, net reproduction rate equal to 1 matlab hota hai we have achieved replacement level of fertility. Santini, put your ask me towards the end once again, I'll tell you. Okay, just ask me once again, I'll tell you. So there's one way. Net reproduction rate 1 matlab hota hai population is stable. Okay, population is stable. That means, see, I have one daughter. Okay, so when I am going to replace myself with exactly one daughter, okay, all right, who should survive till childbearing age? ठीक है. So if every woman replaces herself exactly with one girl child, we will achieve net reproduction rate of 1 where the population will stabilize. ठीक है. और ये होने के लिए couple protection rate, how many couples are using a contraceptive method, has to be at least 60%. Okay, and when this happens, then तुम्हारा total fertility rate will become 2.1. That means every couple is going to have 2 children. 60%, not 40%, 60%. Okay, so for net reproduction rate to be equal to 1, couple protection rate means how many couples are being protected with a contraceptive method should be equal to 60%, and this will happen only and only when this happens, TFR will automatically become 2.1. ठीक है, जब 2.1 is the desirable TFR that every country wants. Okay, but as of now please remember, India के लिए TFR कितना हो गया है? Already we have achieved TFR of 2. Okay, we have achieved TFR of 2, and couple protection rate right now in India is 66.7%. But that does not mean that no, TFR of India is now 2. Okay, but that does not mean population has become stable. We need to maintain that thing. Okay, everyone understood these topics? Okay, they are very, very important for your exams, so please remember that. Okay, all right, now let us look at some very, very important contraceptives, guys. Okay, which contraceptive is this? Which contraceptive is this? We'll look at some important contraceptives which keep coming in our exams. Which contraceptive is this? Can you tell me? Diaphragm? No. This is a very good. This is a what? Female condom. Female condom में कितने rings हैं, guys? 2 rings. All right. That's how you will identify it. It has 2 rings. All right. Female condom is which method of contraceptive? Barrier method. Okay. Who invented this? MD Hessel. Okay. Now, another question. Can you reuse a female condom? Yes. Okay. It can be reused. Male condoms cannot be reused. Female condoms can be reused. Okay. Then can a male and a female condom be used together? No. Never use. All these are PYQs. Like they can be put in options. Okay. Never use male and female condom together. Okay. Kabhi bhi never use male and female condom together. That's again one point. Okay. Then female condom is offering, is it protecting from STDs and HIVs? Yes, this also protects from STDs and HIV. STDs and HIV. Is it available under our National Family Welfare Program? No, not available. Okay, this is not available under what? This is not available under National Family Welfare Program. Why? Because it has high failure rate. But is it available under any other program? कोई और program इसको promote कर रहा है? Can you make a guess, or do you know some other program? Yes, National AIDS Control Program के अंदर this is freely available. Okay, under what? National AIDS control program. Why? Because for commercial sex workers, very good Shakshi. Okay, commercial sex workers, at least if the male clients don't want to use a male condom, at least to get some protection, although female condom has a higher failure rate, but something is better than nothing, right? So it is freely available under NACP for commercial sex workers. Okay, this has come many times, female condom, so you need to know not all the contraceptives are important. We are doing all those which have come and which have the potential questions, which have the potential to be asked. What is this contraceptive? You all will know that it is copper T, right? It is a copper containing device. All right, it is a second generation IUCD. But what is the name of this? Everybody is writing. Very good. I think one of you, Besla, wrote 380, Himanshu 380. Very good. This is actually copper T 380A, guys. Okay. Now, what is this 380? 380 millimeter square of copper wire is wound on the horizontal as well as the vertical stems. Okay, you can see that 380 millimeter square of copper wire is wound on which stems? On the horizontal as well as on the vertical stems. They ask you what is this 380. Okay, one question which keeps coming from this is what is the shelf life of this? So the shelf life of this, everybody, is how much? 10 years. Okay, कितना है shelf life इसका? 10 years. What is the shelf life for copper T 380A? 10 years. Now you will remember the image. Okay, another device image is important. ये क्या है? Don't get confused. Copper T 380A नहीं है ये. This is what? Copper T 380AG. Okay, it has silver core. Okay, which stabilizes copper. All right, it has a silver core. इसका दूसरा नाम क्या है? Nova T. Okay, and this has a shelf life of 5 years. Just wanted you to look at the image and understand. Okay, this is Nova T and this has a shelf life of how much? 5 years, everybody. Okay, this has a shelf life of 5 years. Okay, 5 years, 5 years. Copper T 380 only has 10 years. This has 5 years. Okay, another one, this is what? This is multi-load. Can you see? U-shaped multi-load. Copper T 375. Okay, so this you can remember, multi-load. Now what is the question that is coming nowadays? Absolute and relative contraindications. That is very, very important. So if I ask you, previous ectopic pregnancy is a absolute or relative contraindication for IUCD, what will be your answer? Previous ectopic pregnancy, is it a relative or absolute contraindication? Previous, yes, copper T 375. You can write it here. Very good, Shah. All right, if I Lippes lupus first generation, all those you don't need to worry about. Okay, okay. What is previous ectopic pregnancy, a absolute or relative contraindication? Okay, so most of you are writing absolute. So just want you to go through this list with me once because this is very, very important. Okay, contraindications. Absolute is suspected pregnancy, PID. Current PID, because PID, all right, is very, very this thing. Okay, a woman cannot use IUD if she has PID. Vaginal bleeding of undiagnosed etiology, cancer of cervix, uterus, adnexa and previous ectopic. These are all according to our textbook of PARC. अब यहीं पे if you write the relative, okay, you can just compare and write. Instead of suspect pregnancy, you can write menorrhagia or anemia. Why, guys? Why anemia is a relative contraindication? Because please remember, most common side effect, that is also a question. Most common side effect of IUD insertion is what? Most common side effect of IUD insertion क्या है, guys? सबसे common side effect of IUD insertion we all know is bleeding, right? This is, so if any woman is anemic, we need to be very careful in putting this. Although it's a physiological bleeding, you can put her on iron tablets and it gets corrected by 2 to 3 months. All you need to do is tell the mother that it's physiological, it will get corrected on its own. ठीक है? All right. Now PID current है, यहाँ पे लिख लो history of PID. ओके यहाँ पे वजाइनल ब्लीडिंग है, यहाँ पे लिखो पुरुलेंट सर्वाइकल डिस्चार्ज, डिस्चार्ज फ्रॉम द सर्विक्स, ओके, सर्वाइकल डिस्चार्ज। कैंसर ऑफ सर्विक्स यहाँ है, यहाँ पे लिखो यूट्राइन malformation, ओके, हियर यू हैव यूट्राइन malformations like congenital malformations, fibroids and all those things, okay. Previous ectopic pregnancy is a absolute contraindication, yes. Most common side effect is bleeding. Second most common side effect, very good, second most common side effect everybody is pain. And what is the most common cause of removal of IUD, which can again come in your exam? Most common cause of removal, ठीक है, most common cause of removal of IUD guys क्या है, remove करने का reason क्या है? Most common cause of removal again of IUD is pain, okay. So from IUD these questions are very very important, which are definitely turning up in your exams, okay. Here I have separately written relative for you, you can go through it. Anemia, menorrhagia, history of PID, purulent cervical discharge, distortion of uterine cavity like fibroids and all, and unmotivated, yes, unmotivated person is also a relative contraindications because we need to feel for the thread, okay. All right, these are all this thing, ठीक है. Okay, see, copper containing device is not interfering with any hormonal setup of the body, okay. DVT and all that, may we need to be careful with hormonal IUDs like Mirena and that one, ठीक है. Mirena, I hope you know, LNG20, okay. Mirena, it releases 20 micrograms of levonorgestrel every day, okay. This has a shelf life is asked 5 years, okay, 5 to 7 years in fact. And there is one progesta cert, okay, which is having a shelf life of, these are hormonal IUD, 1 year, ठीक है. All right, this is very very important, please don't forget, it can definitely come in your exam. Let's see another contraceptive which is very very common. What is this? Vaginal sponge, diaphragm, chaya, spermicidal gel. ये क्या है? Very good. This is vaginal sponge. You can see a V-shaped band is over here, ठीक है, V-shaped band. This is sold under the brand name of anyone which came in our exams. This image is a neat question, okay, but in FMG they asked the brand name. They gave the photograph of the brand. Very good, Chandni. Very good, it is today. Very good, Sophie. Yes, see, ideally it needs to be inserted before sexual intercourse and it needs to be left 6 hours, ठीक है, left 6 hours after intercourse, okay. But suppose if any person, any lady forgets to take it out, okay, beyond 24 hours, okay, it will lead to what? TSS, toxic shock syndrome. So if you get a question, a woman has used a contraception and she reportedly died, which one is it? Like and if you have this thing, okay, immediate death was reported, okay, it is toxic shock syndrome, it is sponge. And remember, this is a barrier method, yes. This contains a chemical, what is that? Non-oxynol 9, ठीक है. All right, okay, very very good, very very important question. इसमें can you see, identify, see, this is something which is inserted in vagina, then it has to be pushed to be placed over the cervix. Which contraceptive is this? Can you make out from the image which contraceptive is this? It has the same mechanism as a vaginal sponge. ये क्या है? Very good. Don't say yes, it's reusable. Love, it's reusable. Vaginal sponge and diaphragms both are reusable, okay. All right, so this is what? This is a diaphragm. यहाँ पे if it was a vaginal sponge, you will see the V band, okay, but this is not here. So this is a cap like thing, diaphragm. Everything is the same for vagina, just like vaginal sponge, only diaphragm has less failure rate. Also remember, neither vaginal sponge nor diaphragm protect from STDs, okay. No protection from STDs, okay, no protection from STDs. ना तो vaginal sponge protect करता है, ना diaphragms. No protection from STDs, okay. So that is again an important question which can be asked. Everything is the same. See here, you will see today, ठीक है, vaginal vaginal sponge, non-oxynine, it's available under brand name that we've already discussed. Another question which is turning out nowadays is what is Antara, guys? We are not revising entire contraceptives. For that you can listen to the rapid revision videos on the app, okay, but right now we are doing all those important ones. So can you tell me अंतरा मैंने क्यों लिखा है? प्लीज़ रिमेंबर, अंतरा इज़ नथिंग बट इंजेक्टेबल DMPA, डीपोट मिड्रॉक्सी प्रोजेस्ट्रॉन एसिटेट, 150 milligram intramuscularly every 3 months. Okay, and now this is freely available. Okay, this is freely available till level of subcenters. Okay, till level of what? Subcenters under what? National Family Welfare Program. So it is freely available till level of subcenters under National Family Welfare Program. Okay, this is DMPA. इसका दूसरा नाम क्या है guys? अंतरा. ठीक है, अंतरा. All right, and another contraceptive which is now freely available till the level of subcenters, I hope you remember, छाया. ठीक है, छाया is also freely available. छाया is nothing but सहेली, or it was also sent Croman. Okay, it is also sent Croman. ठीक है, this is also freely available till level of subcenter. Very good. Okay, so newer contraceptives Antara and Chaya. The only side effect of this is irregular menses. Okay, irregular menses. Otherwise it's a pretty good contraceptive. Okay, it's injectable. Chalo, now you can see over here. All right, this is what? This is oral contraceptive pill. Okay, it has iron, 60 milligram iron इसमें भी contained होता है. These are OCPs and these are the iron tablets. Now the important thing is that the important thing which could come in your, yes, Central Drug Research Institute Lucknow has developed Chaya. Very good. Okay, now here another question is which oral contraceptive pill is freely available till the level of subcenter? So can you see Mala N? N stands for no cost. Okay, this is freely available till the level of subcenter. Okay, all right, and this is family planning logo, if you can see. ठीक है, family planning logo. But there is another contraceptive OCP which is being promoted under social marketing scheme at a minimal cost, ₹1 for a pack of OCP. Okay, which is this one. Can you see? Ferrous fumarate tablet, Mala D का दुकान. Okay, D's का दुकान. So this is available at ₹1 for a pack of OCP. ठीक है, ₹1 for a pack of OCP. इसको क्या बोलते हैं? This is nothing but social marketing scheme. Okay, we are just trying to promote behavioral change over here, guys. Okay, under the social marketing scheme. All right, everybody, Mala and Mala D. ठीक है, and what is the content of estrogen and progesterone in these? These are combined oral contraceptive pills. So you can see over here both of them have progesterone 0.15 mg, all right, and ethinyl estradiol 0.03. you could be asked this. ठीक है, all right, this was the older one, this is now ₹1. Okay, everyone. ठीक है, now guys, the important thing is which is the most important emergency contraceptive? This is emergency contraceptive. ठीक है, I pill. But here I would like to tell you, Suman is different than it. Suman is a maternal initiative. We'll discuss about that. Okay, सुरक्षित मातृत्व आश्वासन वो अलग है. All right, okay. Now if I ask you best emergency contraception क्या है? Best emergency contraception, which is it? Best emergency, yes, contraception is best. Please remember, best is IUCD because it can be used up to 5 days. But it is not preferred. Okay, it is not preferred because it cannot be put in a nulliparous. Okay, one who has not had any children, and mostly emergency contraception would be wanted by maybe young people who are not yet married. Even if they are married, they don't want any kids. Okay, so What is the preferred emergency contraception now? I pill. Okay, it is a single dose of levonorgestrel. Okay, very good. 1.5 mg LNG to be taken up to 72 hours. Okay, it should be taken within 72 hours. All right, this is a pink color tablet. Okay, this is an important question which can turn up. Now coming to one more topic which keeps coming in our exams, guys, is about vasectomy. See, it came in 2020, it also came in 2023. So I just want to discuss this. A male had a vasectomy 1 month ago, and couple asked the doctor if they have to take any precaution. Okay, so what will the doctor advise? What is the answer to this? Nothing much. nausea हो सकता है थोड़ा बहुत. Okay, not any specific one. All right, yes, use condoms for 3 months, 3 months or up to 30 ejaculations free. Okay, this is a very commonly asked questions nowadays, guys. This is very important, so I just want you to see once. Important post-op advice after vasectomy: use alternate contraception, barrier method, not any pills or anything, for at least 3 months or 30 ejaculation free, no heavy lifting, and scrotal support for 2 months. ठीक है? Yes, this is a very important this question. Now you all know, when you talk about vasectomy, since they keep asking some golden points, it's a safe and simpler method. Minimum length of vas cut for effective sterilization is at least 1 centimeter. ठीक है? All right, barrier method for 3 months, non-scalpel vasectomy, no stitches required, daycare procedure. This again is important. Most common cause of failure of vasectomy in India क्या है? Misidentification of vas deferens by the surgeon. And please remember, this is the most cost effective method. Most cost effective method of contraception is vasectomy. It has reported least failure rate, even less than tubectomy, but hardly 0.3% तक कोई प्रैक्टिस करता होगा इसको. ठीक है? Yes, Anthony, best तुम्हारा emergency is IUCD because it can be put up to 5 days. All right, everybody, so that is it. Okay, one more thing over here, you can see who can get male sterilization. ये देख लो एक बार. Married or ever married, less than 60 years, at least one child more than 1 year. Please don't say many children have, many students are saying that at least you need to have 2 children to get a vasectomy or tubectomy done. No, at least one child up to 1 year. Do you need husband or wife's permission for this? No. All right, it's not that अगर wife को करवाना है tubectomy, she doesn't need the husband's permission. Husband wants to get a vasectomy, doesn't need the woman's permission. MTP can now be done up to 24 weeks, right? First 20 weeks only one doctor, 20 to 24 weeks 2 doctor. It can also go beyond 24 weeks in certain cases as decided by the medical board. Okay, some congenital malformation has been diagnosed or some other abuse kind of cases. All right, everybody. Okay, please remember one more thing here. I would like to tell you, for females, guys, for females, can you see the criteria for tubectomy? ठीक है, tubectomy के लिए eligibility criteria एक बार देख लो. 22 to 49 years. Males is 60 years. Okay, this is 22 to 49 years. And again, one child more than 1 year. Yes, it is the best, Varun. Vasectomy has the least failure rate, all right, lower than tubectomy, and it is the best. Okay, all right, everybody, did you understand? I just want you to know that no permission is required of husband or wife in cases of tubectomy, vasectomy, and at least one child the couple should have up to 1 year. 2 children category नहीं होता है. Got it? Everyone understood? Okay, so this was the session for today. A quick one. I just wanted to revise. क्या बताना है कोमल? What do you want to know? Myrina is अच्छा, Pearl Index. I'll tell you about Pearl Index. Okay, Myrina Komal is LNG20. Okay, when I talk about Myrina, okay, this is a 3rd generation IUD. Okay, this is what hormone containing, hormonal containing. All right, which hormone is it having? Levonorgestrel. Okay, that is why LNG20 इसका नाम है, and L20 microgram of levonorgestrel is being released every day. Okay, now best thing about Mirena Komal is, out of all the IUCDs, it has the least failure rate. Okay, least failure rate out of all IUDs. Out of all intrauterine devices, Mirena has the least failure rate. Is it clear? ठीक है? Okay, when you talk about Pearl index is expressing the failure rate of a contraceptive. ठीक है? failure rate of a contraceptive. So you just have to know its definition. Total accidental pregnancies जितनी भी हुई, okay, divided by the total months of exposure, not years. You have to write it in months, multiplied by 1200. 1200 क्यों? Because we express Pearl index in 100 women years. Okay, failure rate is expressed in 100 woman years, and 100 woman years is going to have altogether how many months? 1200 months. Okay, so that is what is Pearl index. Okay, it is used to express what? The failure rate of a contraceptive, total accidental pregnancies divided by total month of exposure into 1200. Okay, everyone, ठीक है? All right. Okay, population pyramid. I think I might have an image for that. Let me quickly show you once. Population pyramid अगर है मेरे पास. Yeah, look, population pyramid में this is what? This is the population pyramid of a developing country. Alright, population pyramid gives us the age and sex composition. ठीक है? देखो यहाँ पे देखो. This is developing country. Alright, this is developed country. And if you can look, it has age. This is age on the y-axis. Okay, and it has gender composition. ठीक है? Now broad base किसका है? Broad base is of developing. Why? Because more fertility. Okay, narrow base किसका है? Developed का, less fertility. This is obtuse apex. This is acute apex. Acute apex, why? Because fewer elderly. Okay, fewer elderly. But यहाँ पे obtuse apex. Why? More elderly in developed country. Quality of life is good, right? Now which pyramid is taller? This is taller. Taller pyramid means more life expectancy. People are going to live longer in developed. This is shorter pyramid. Okay, shorter pyramid means lesser life expectancy. ठीक है? बीच का पोर्शन वर्किंग क्लास होता है, ऊपर एल्डरलीज होते हैं. ठीक है? दिस इज व्हाट? शेप अपवर्ड ट्राइंगुलर. दिस इज व्हाट? अपवर्ड ट्राइंगुलर. एंड दिस वन राइट हियर इज स्पिंडल शेप्ड. ओके, इज इट क्लियर? All right, death certificate you can go through once, Komal. It was a very old question, although ठीक है, एक बार देख सकते हो. If you want, it hasn't come from quite some time now. All right, everybody. Okay, safe period is what? Like, you know, when 10th to 17th day a woman can conceive any time. All right, so before that and after that is the safe period. You can refer to that from OBG as well. Okay everyone, so that's it for today. Please remember, Telegram quiz will be there at 10:30 p.m. I have already given the link for Telegram on the option for this also. All right, Telegram quiz is at 10:30 p.m. Now any other thing you want to do, you can just refer to my video on prep ladder, rapid revision ka video. All right, you can refer to that as well. Okay, that is very very. Demography gift होता है कितने? You know, there are two terms, demographic bonus and demographic burden. Okay, bonus मतलब होता है डिपेंडेंसी रेशियो घटना, बर्डन मतलब बढ़ना. डेमोग्राफी गिफ्ट इज भास्कर दैट व्हाट अबाउट द वर्किंग पॉपुलेशन. ओके, हाउ मच इज इट कंट्रीब्यूटिंग टू इकोनॉमिक डेवलपमेंट. ठीक है, दैट इज इट. Okay, all right, chalo, so I think I've wrapped up. We'll take up again today. Tomorrow I'll meet you. Bye bye, keep revising, keep studying, have a good day, keep sharing with your friends as well. Okay, I will see you soon. Okay, on 30th there is no class, everybody. On 30th there is no class. Okay, but tomorrow and day after we will be having classes. Okay, thank you so much. Bye.